Welcome to the Advancing the Kingdom podcast. We're streaming live on all social media platforms and podcast streaming channels. Get ready for a revelatory teaching from our apostle, Matthew Tillery.
Well, thank you so much for tuning in to the Advancing the Kingdom podcast. I am your host tonight, Matt Tillery, and let me turn this down. And we're going to get started. There you go. Thank you so much for tuning in to the Advancing the Kingdom podcast. Listen, I'm really excited about tonight. It's going to be a great podcast tonight, getting information and education out. I think that's very relevant. I think it's very critical, and I think it's very important that we do that. Tonight is none other than Dr. Denise Gooch. She's keeping it real with Dr. Gooch. She comes on every fourth Monday of the month, and it's a blessing and a tremendous, just tremendously blessed to have her to come on each month to share. I know she's very busy, but she certainly take time out every fourth Monday to come on and share with us. She's from Silver Spring, certified radiation oncologist, and just once again, grateful to have her on. Listen, September is Prostate Cancer Awareness Month. African American men, and somebody asked the question, why do you keep talking about prostate cancer? Well, when black men, particularly African American men, stop dying from prostate cancer, I'll stop talking about it. But until that happens, I have to keep sharing the news about it. September is Prostate Cancer Awareness Month. African American men are 1.7 times more likely to be diagnosed with prostate cancer and 2.1 times more likely to die from prostate cancer than white men. African American men are also slightly more likely, once again, to be diagnosed with the advanced disease. So by the time we find out, oftentimes it is advanced. And so we need to have these conversations. If you going to have some questions tonight, you can certainly make those comments, comment in Facebook, or you can do it on YouTube. We're live on Facebook and YouTube, so you can go in the comment section and you can ask questions, and we'll try to make sure that we get to it. Listen, thank you, Dr. Gooch, for coming on tonight.
Thank you so much for having me. As you said, I actually enjoy these podcasts and the opportunity to share information and hopefully answer questions that people may have, because you just stated correctly, prostate cancer is very common. Unfortunately, it is the number one diagnosed cancer in men. I mean, people think of all this as actually, especially African American men, are more likely to be diagnosed with prostate cancer than women are to be diagnosed with breast cancer. So you hear a lot of information about breast cancer, and they have all these walks and all this information being shared. But the same thing isn't happening for our men with prostate cancer, and it is the number 2 cause of death for men. So anyone who knows me knows that's why I'm not an advocate for this active surveillance or watchful waiting or whatever term, like I disappeared. Until our men stop dying from prostate cancer, we definitely still need to get the word out to make sure that men are being evaluated and screened, and most importantly, treated for this highly curable disease.
Wow. So that's why I guess now, getting screened.
The other reason I'm happy to.
I'm sorry, go ahead. No, go ahead. Yeah, go ahead.
Please go ahead.
No, I was just saying this is why getting screened is so important, right?
Yes. People misunderstand, and sometimes I'm asked a lot, like, what are the symptoms of prostate? There are no symptoms. Well, there are, but by the time you have symptoms, unfortunately, it's usually advanced. So that's what screening means. You know, we always take the correlation of women being screened for they get mammograms. They don't just get mammograms when they can palpate something. Women are recommended to get screened. So that means that you're being tested when you're not symptomatic. That's the whole meaning of screening. So for the exact same reason, men should be screened, because as I said, men are more likely to be diagnosed. African American men are more likely to be diagnosed with prostate cancer. So that's why they definitely need to undergo screening for this. And if your primary care doctor or whoever is telling you that's something you don't need to do, you need to tell them to reevaluate their current data, because it is something you need to do. And when our Black men stop dying from it, as you said, then we can stop pushing so hard.
Right. Yeah, I did I was invited to really just talk about my prostate cancer journey. And there was a gentleman there. After I started talking to him about it, he started talking about the PSA. He said his PSA was a 9. And I asked him, have you had a conversation with your doctor? Because that's pretty high, I think. In my terminology, I think it's pretty high. But he said no. He said he had talked to the doctor. He did the PSA, and the doctor told him, we don't panic. We'll just look at it next time. And if it goes up, we'll just keep a check on it, but there's no need to do a biopsy or any other further testing. Well, he went back and kind of told the doctor he really wanted to get some more testing done, and he found out he had prostate cancer.
Yes, unfortunate. That is a very common story that I hear. As you said, not only is it that quote unquote active surveillance, and then when a man finally gets diagnosed or the workup occurs, they're diagnosed with prostate cancer, but it's oftentimes more advanced than what even the primary care doctor initially thought it was. They thought it was, it's just a slow growing. And then when they check it again, maybe it was a 6, and then they check it again in a year, which is not what the American Cancer Society recommends. They recommend checking it every 6 months. They check it in a year, and now it's double, it's 12. Then they undergo prostate biopsies, and then everybody's moving so quickly. And of course, the man in the process is thinking, well, gee, everybody's rushing me to get all these tests and biopsies and diagnoses now. What about a year ago when we already knew it was elevated? So that's why sharing this type of information is so important.
Wow. Well, some powerful stuff. So let's get into this topic tonight, just for a little bit.
Yes.
It's a very difficult topic for some men to discuss, but erectile dysfunction, or ED, once again, it can be a very difficult topic to discuss, but we need to have these types of conversations. We need to talk about it. So what is erectile dysfunction, or ED, and how does prostate cancer treatment affects it?
Well, thank you for giving me a platform to discuss this. As you said, for reasons I'm not quite clear, but I guess it's just maybe our society, this isn't something that we talk about a lot.
Right.
Unfortunately, it tends to be quite common. I sometimes think that if a man is maybe hesitant and doesn't want to ask his doctor about it, if he's having those types of symptoms, he doesn't realize that if we talk about 5 questions the doctor is being asked, that's totally within the top 5, probably in the top 2. So we're asked this a lot, okay? So let's get the definition of erectile dysfunction. Well, for one thing, I want all men to realize that, and we're going to have some adult conversation here, for a man to lose his erection now and then does not mean he has erectile dysfunction. There can be a lot of stressors on his mind. He can be tired. He can be overworked. He can have other psychological issues going on. He can have relationship issues. But as I said, outside stressors can affect the physiology of a man getting, and more importantly, sustaining an erection. We think erectile dysfunction is not that he can't get an erection, but to sustain it. But let's talk about the physiology of it, which I think no one ever talks about. Doctors know it, but we don't discuss it with our patients. So let's talk about it. Interestingly, it's kind of like what maybe your girlfriend or your wife or somebody says, and they kind of tease you about it. But erections, quote unquote, start off in the brain. It's the whole saying, the best sex goes on between the ears. It really does start in the brain. Right? So this is going to be some adult conversation. So in order for a man to get an erection, basically, because of some stimuli, either visual, some physical stimuli, thought process, something like that, it actually triggers a reaction in a man's brain. Okay. And then the brain sends off a signal to release nitric oxide. It's actually, this is totally a physiologic response.
Wow.
This nitric oxide causes vasodilatation, okay, a relaxation of the muscles, especially if he's sexually stimulated in his penis. And what does that mean? That means there's blood flow that flows into his penis, all right? And as a certain amount of blood flows into the penis, it will cause the penis to become hard, as they say. So then a man has an erection. And if that results in sexual activity with a partner or without, so that's what the whole process of an erection is. So erectile dysfunction, quote unquote, basically means maybe something isn't going along in that process, that kind of three-part process I just talked about. Usually he may have the stimulation, but maybe because of like heart disease, cardiovascular disease, diabetes, the blood flow isn't flowing the way it should be. Okay. Also, because of, as I just mentioned, the diabetes, maybe the nerves that also transmit that signal from the brain isn't working. So anything that interferes with that process that I just talked about can trigger erectile dysfunction. So there's other things too, things like your basic physical health, just like anything. If you're healthier, you have better blood flow. Remember, it causes vasodilatation. So you have blood flow, you have improved blood flow. If a man is overweight, the thing about being overweight, that doesn't necessarily cause erectile dysfunction, but it causes hormonal imbalance. A lot of people may realize that unfortunately excess fat can be affected. The fat actually causes something, there's an enzyme in some of the fat cells called aromatase, okay? And it can convert some of that testosterone into estrogen. That's why you see a lot of overweight men start getting gynecomastia. So, or basically man boobs. So that's why it's important, which of course is counteracting his ability to try to function as a man. So that's why certain things that men can do for themselves, be more physically active, control their high blood pressure and diabetes, try to reduce their stress. Okay, we all have stress in our lives, so try to reduce their stress, improve their diet. Okay, that's something else. Of course, improving your diet is going to make you healthier, going to improve your weight. You see, there's kind of a cascade of things that can help a man to improve his whole body and his bodily functioning that will lessen the amount of erectile dysfunction that he could have, that he may be having transiently, or he may notice is gradually starting to happen more and more often.
Wow. Wow, you said a lot. so I guess.
Yes, I did.
Yeah, but we're keeping it real with Dr. Gooch tonight. So listen, so exercising and those things that can keep the blood flowing, that is certainly a help, correct?
Blood flow, absolutely, about blood flow.
Great. So somebody has a question and they say, are there long-term?
Absolutely, that's how a man gets an erection. That's the only way, there's three parts: the brain, the nerves, and the blood. So anything a man can do to increase blood flow, exercise is important because, like you said, you need that blood flowing all the way throughout your entire body, but some blood from the body. Same is circulating every way throughout your body. So he doesn't have any extra supplies. So the better, the stronger and healthier you can keep your body with the blood flowing, all right, throughout your entire body, the more likely you're able to basically get and sustain an erection.
So the brain, the nerve, and blood flow, those three things work together.
That's right. Those are the trifecta.
Gotcha.
You need those three things. Anything
Gotcha.
that interferes with one of those three things, okay? That's why sometimes if people have neurologic symptoms like Parkinson's disease, or if a man has a spinal cord injury, things like that, because then you have an interruption with the nerve supply. So
Right.
those would interfere with the man's ability to have an erection. And I just mentioned the cardiovascular disease, the diabetes, the high blood pressure. that interferes with the blood flow, okay? Because you cardiovascular, you have the stenosis or the narrowing of the blood vessels. So that blood, just like it can't get to other parts of your body, isn't going to get down there either. So remember, you only have the
Right.
same blood that's circulating throughout your body, is trying to go down there too. So yeah, anything we can do to reduce any of those medical will help a man have better erections.
Okay. Yeah. So can you hear me, Dr. Gooch? I think we're having some little technical.
Now, the other question I just wanted to bring up is something I mentioned to some of my colleagues talks. One thing men don't want to do prostate cancer about prostate health is because of erectile dysfunction. And it's real. It's not, remember I talked about we're not affecting the brain, but those other two are areas. He has surgery, whether he has radiation or whether that's external beam or protons, or we do what they call the brachytherapy seeds. Yes, those can affect either the nerve supply or the blood supply. All right. So that's why everyone's heard about the nerve sparing prostatectomy. That's what they're trying to say. They're sparing the nerves that allow a man to get an erection. But the external causes scarring, fibrosis of the nerves as well as of the blood vessels. So that could have his ability to get an erection also. So we look at all of that, and that's an important conversation, doctor, before you undergo the treatment, because I know the fear of that for men, it's a real fear, but as long as it's managed early, and as I mentioned before, anyone who's ever heard me talk, one of the things that I do for any man that I'm radiating before they actually start is I start them on Cialis or Viagra. That's my routine, unless there's a medical contraindication, to make sure I maintain that blood flow. Okay, so I'm not going to wait for them to get scarring and fibrosis. And there have been studies that have supported that. As a matter of fact, one of the questions that we were asked the last time was about the penile shortening related to the surgery. There's actually been a study that was out of New York that showed that if men were started on Cialis before the surgery, they did not have that penile shortening. So,
oh wow, that's pretty interesting.
To be honest with you, yeah, no, it's true.
Wow.
And I've actually talked to men for some reasons I'm not quite sure of. Most of their doctors don't talk to them about this. So I tell them, mention it to your doctor, and I guarantee they won't. They won't care. They're like, "Oh, you want me to write? Sure." They just put in the EMR. Sure, okay, go ahead and pick up your Cialis or Viagra. Right. But it's important. So that's another case of men advocating for themselves.
Right. So I have a question. Are there long-term health implications to consider when taking ED meds?
Well, that's a good question. That was actually my next topic. The truth is, the ED meds, as long as men are taking them as directed, all right, and remember we talked about what they do is, remember I told you with the brain, it releases the nitric oxide. Right. What it does, it, potentiates that, or basically kind of, accentuates the effects of that, as well as it slows down the breakdown, because what causes a man, especially after he ejaculates, to lose his erection is the breakdown of that nitric oxide. All right. So it actually slows down the breakdown. So that's why, especially the Cialis is ready when you are, and it'll just kind of stay in 24 or 36 hours or something. That's what it's doing. It's maintaining this nitric oxide level so it doesn't break down.
Wow.
So unless a person is overdoing it, now you have to, the three most common ones, of course, Cialis, Viagra, and then there's Stendra, which now has they have a what they call I'm sorry. Well, the most common ones are Cialis and Viagra, as you know, and Stendra is the most recent one. Now, one thing about Stendra, and it's Avanadil, they just have a generic. They just came out with a generic about a year ago. It costs more, of course, because it's the most recent one, but apparently It's considered to have less side effects. It apparently starts in a shorter period of time. Cialis, Viagra, they said you have to allow an hour, but it only lasts 4 to 6 hours. Cialis starts within 30 minutes, but of course you can last 24 to 36 hours depending on the long acting. And the Evanderfil is actually somewhere in between, so it can last from 6 to 8 hours, but it only requires 15 minutes of after you take it that it basically it'll be ready to work. So that's the difference in the three. So my feeling is, as long as someone's not taking it long term,
Right.
every day, I think they should be medically safe to take it on a long-term basis. It won't cause any long-term problems.
Right. So how does ED and high blood pressure medication, ED medication and high blood pressure medication, I guess the question is, will the blood pressure be lowered more?
Well, yeah, you see, that's one of the reasons why it's important that men undergo a medical evaluation before they start any of these medications, because what this medication does is cause vasodilatation, which means it, causes the blood vessels to expand, which, depending on if you're already on medicine for high blood pressure, it could drop your blood pressure too low. And especially if men have a history of heart disease, because they may already be on nitrates. So if you're already on nitrates and you add this to it, basically it could trigger off a heart attack. So that's why there are warnings before a man takes any of these medications, because of the way they work. They're based on, the release of the nitrous oxide. So if a man is already on nitrates, he needs to be careful, and he definitely needs to have that cleared by his family doctor before he starts taking any of this medication.
Wow. This is some powerful stuff tonight, and just really appreciate it. Once again, we have to have these conversations. I know sometimes they are very difficult, and the reason why this podcast is happening, because I'm not going to talk about this on Sunday mornings. So now it's a good Monday nights, keeping it real with Dr. Gooch. It's a good opportunity and a good time to hit these subjects that we don't really want to talk about. So somebody asked, what is the mechanism of action of each ED meds, and do you recommend one over the other?
And that's a good question. It's what we just talked about. What they do is they, as I said, they actually potentiate the effect of what the brain is doing, the release of the nitrous oxide, all right? And they slow down the breakdown of it. So that helps a man get an erection, and it slows down the breakdown of it, so it helps a man maintain an erection. Now, which one I prefer over the other? I actually have a slight bias in a positive way towards Cialis.
Right.
Because my issue with Viagra is that, number one, as they say, it takes like an hour. Plus, they actually have a list of different medications that you shouldn't take with Viagra. You probably have heard about that. And the list is longer for Viagra than Cialis, so I personally feel that Cialis is safer.
Right.
Now, Avendra, the newest one, Stendra, Evanderfil, like I said, it's considered newer, it's considered safer, but that's the whole thing. Just because something is new doesn't mean we have all the information on it. And as I said, and it's a lot more expensive. One of the things I looked at was the cost. And it was actually amazing that when I looked at it and I found it, they actually stated that I think it was like $82 and something for 6 pills. It was just ridiculous. And that was with a drug card. So
wow.
In terms of costs and things like that, I personally feel that Cialis is probably the safest. And like I said, that's my bias in terms of prescribing medications for a man who wants to try them. Wow.
So what are your thoughts on penile implants?
Now, as a matter of fact, that's another good question. So it's kind of a series. No, this is
some good stuff here.
I know. So we actually, for a man who has erectile dysfunction, as a matter of fact, is actually kind of considered a series of steps that is probably recommended that a man take. So let's say he tries the pills first, okay? And remember, we need the pills, but you need blood supply and nerve supply. So let's say the pills don't work for him, okay?
Right.
Then the next step, okay, we don't go straight to a penile implant. We
Yeah.
kind of
So you don't go straight to.
no, you don't go straight to it. The next step would be they actually have injections. Now, I have to tell you, you need to talk to your urologist, and they can explain all of these to you. And from what my own research is a very thin needle that's inserted into the base of the penis, and what it does, it directly causes the vasodilatation for a man to be able to get an erection. Then they have something called Muse, which are little suppositories that a man inserts right into his urethra. Now that sounds, but they're very, very thin. They're very, very small. Right into the urethra. That also triggers off vasodilatation, so the blood can flow into the penis and can cause an erection. And that lasts, I believe, it takes about 10 to 15 minutes, and it can last 2 to 3 hours. I think some of these treatments are like, you hear these commercials, they say you go to this doctor's office and you'll have an erection right there in the office. I'm almost certain that's what they're using. Now, they also have a vacuum pump, and basically what that is, a man puts that on his penis, and it kind of works like they say, like a bicycle pump. From what I was told, it kind of sucks the air, it kind of pumps air out and then sucks the blood in while it's pumping air out. And then a man is instructed to use a penile ring kind of to hold the erection so he doesn't lose it, so the blood doesn't flow back out again. And then after all of those that are tried, still is not able to get a satisfactory erection, then a man could discuss getting a penile implant.
Awesome. Yeah, I have a guy coming on, I think he's next Monday, I think, and he's going to talk about that. He actually has one. So, and he basically went through those steps that you just talked about.
Yes.
So he didn't go straight to the 747.
Yeah, no, well, I don't think any doctor hopefully would allow or basically start with, as you said, the 747. Because, like you said, this is adult conversation again.
Right.
Because, that's not an inflatable and deflatable. That's a constant.
Right.
So that's once he has a penile implant, whatever the material that is a basically a semi-permanent state of erection. So that's the other thing. So no, a doctor isn't going to go straight to that. Right.
Yeah. Great conversation tonight. What would you say to those men that, they say, well, I have some issues going on in terms of, well, it could be urine flow or whatever, maybe some prostate issues. And they're saying that, I don't want to go to the doctor because if I go to, and I've heard this mentioned before, if I go to the doctor, I might not be able to have sex no more. What would you say to those men?
Well, I think that's a very common fear.
Yeah.
That doesn't surprise me at all. I mean, I know probably quite a few people who are listening to this are thinking the exact same thing. And that's a very common fear. I hear it a lot.
Right.
And one thing we emphasize in terms of education is that, number one, when you've heard us describe, there are a lot of good treatments for erectile dysfunction. All the other extremes that we talked about. Now, I'm not saying we do have them available, but most men, believe it or not, 60 to 70% of men respond just to the pills. So the pills work well for most men.
Right.
But what I don't want is for a man to not undergo screening or treatment for prostate cancer for fear of lack of ability to have sex. Because as we've said, which sounds kind of morbid, you're not going to be having sex in your coffin.
Right, exactly.
This is the number 2 cause of death. This, unfortunately, we always tell people, Martin Luther King Jr., he died of prostate cancer.
Right.
And in this day and age, with all the technology that we have and all the treatment options that we have, no man should die of prostate cancer. I mean, that's to me, that is such a loss and a waste whenever I hear, and you said even earlier, for men to even be diagnosed at a later stage. We have all the tools in our tool belt to have men diagnosed at an early stage where we can cure them. Every time I have a conversation with someone about this, it actually, I tell people, it upsets me because there's no other cancer that I treat that has such a high cure rate. This has the highest cure rate of any cancer I treat.
Wow.
So I don't want any man to die. And actually, when I have given talks and I mention this, and I'll even say, I guarantee you, if your wife knew, or your girlfriend, or whoever your partner is, knew that you didn't want to get screened or treated for prostate cancer because you're worried about erectile dysfunction or not being able to have sex again, they'll probably look at you like you're crazy, because trust me, they'd rather have you than to be able to, for you to be able to quote unquote have sex. And every time the wife was looking at me strange, like I'm saying something strange, like, of course I'd rather have him. But all the men are like, yeah, well, but that's the truth. Your wife, girlfriend, or your partner would rather have you alive than basically having to put, roses on your coffin. Trust me. So That's what men need to consider. Your loved ones need you here. Right. And trust me, we have treatments for the side effects. Like I said, it works in 70 to 80% of men. And if all else fails, like you see with the penile, we got them all covered. We got 100% of men covered, technically. We got everybody covered.
Wow. So listen, man, it's very vital. It's very critical. It's very important. I have a passion for it because I was diagnosed with prostate cancer. It was confined to the prostate, and was able to, go ahead and do what I needed to do, minimal side effects. But I caught it early because of the blood work, PSA. So, Dr. Gooch just told us that this, if you can catch it early, I mean, you can deal with it. So it's not like a death sentence. I was at my urologist a couple of years ago. And he came in there, he was very sad, and I was trying to figure out, I said, man, why is my doctor, why is he behaving like this, right? I'm the one that should be sad or whatever, and he said that one of his patients committed suicide because he found out he had prostate cancer. And he told me, he said that it wasn't a death sentence. He could have lived, but he got the news and just so emotional about it, he committed suicide. So that's very sad,
That's heartbreaking. It's the number one. It has the highest cure rate of any cancer I treat. I don't have any other cancer that I treat that has this high cure rate.
Wow.
As you just stated, if we diagnose it early, prostate cancer, early diagnosed prostate cancer has everybody's heard me say this over and over again. And if you look at the CDC, the CDC as well as the American Cancer Society data, they have graphs and charts that can show you it has a 99% 5-year survival. It has a 95% 10-year survival.
Wow.
Nothing we treat even comes close to that. It doesn't even come close. So as you said, for your urologist to tell you that someone committed suicide, now I will tell you, I've talked to quite a few men who are quote unquote devastated, traumatized. And I do understand. I mean,
right.
Their life as they envision it and as they see it is over.
Right.
But it isn't.
Right.
This is kind of maybe a little bump in the road, but this definitely is not the end of the road. That's for certain.
Right. Yeah.
And that's why people, we talk about prostate cancer, we talk about breast cancer survivors, but to me, for prostate cancer, I consider men who are brave enough, strong enough to go out and do what needs to be done. I consider them prostate cancer warriors. I don't consider them survivors. You're warriors.
Right.
That's the way I see it, as warriors.
Right.
That shows the essence of a true man.
Right. Yeah, and it's very critical and very important that you do research. I mean, you have to be, you talked about it earlier, you have to be your own best advocate. Mm-hmm. So you have to do research. Having a conversation with you before I had any treatment, and I'm always grateful for that conversation because, you talked to me almost an hour over the phone. So, and I was able to gather a lot of information, and I made my decision based on the information that I got from you, and it worked out pretty well, I think.
I think it worked out wonderful. I was honored to be able to be of service to you on your journey. As you said, it's every time I'm asked to speak to someone, or my buddy Will Battle asked me, could I talk to someone? I am honored because I realize to them, they're at a fork in the road. And like you said, it's kind of like, whoa, wait a minute. So what happens now? And to me, it's like, no, it's not what happens now. It's what happens next.
Right.
Because this is something we can take care of.
Right.
I can't say that about every other cancer, actually. I that's what I do. I treat cancer all day. Okay.
Right.
I cannot give every one of my patients the same prognosis and diagnosis, whatever, that I can for my prostate cancer patients. I wish I could.
Wow.
But I can't.
Yeah. Yeah, that's powerful.
Yeah, it is very powerful. That's why, like you said, this is your ministry. That's why it's become my ministry, because for men to get this information, to realize you get diagnosed, you get treated, you're going to be here 5 or 10 years from now. You've heard me say this before.
Right.
You're going to see your kids graduate from college. You're going to walk your daughter down the aisle. You're going to hold your first grandbaby. But if you don't,
right.
You very well may, like, you probably won't do any of those things. And as you know, from talking to family members who have, or wives, or who have lost loved ones to prostate cancer, they're devastated. I mean, I'm honored that they have all of these legacies that they, are basically honoring their husbands and their fathers and things like that. But it breaks my heart when I think, maybe if we had seen them a year earlier, or they had undergone treatment a year earlier, they'd be sitting there beside you instead of you giving them, doing a tribute to them.
Right.
They'd be there with you.
Wow. Yeah, my grandfather had prostate cancer. My father had prostate cancer, and one of my brothers in Baltimore had prostate cancer. So I was very, just being very tuned in to make sure that I'm doing what I needed to do to stay on top of that PSA and just really make sure I was on top of those things.
And I'm glad you mentioned that, because we've noticed, and I've been asked this a lot, is there a genetic connection? There is, and I'll be honest with you, we're not sure exactly what it is, but what you just described is something I hear very commonly. So you basically had 3 first-degree relatives who had prostate cancer, all right?
Right.
Which means that whatever the gene may be, which we haven't distinguished, unlike for breast cancer, but there is an interesting tie-in.
Right.
That we found that certain men with high-grade prostate cancer, not just the regular, but the high-grade prostate cancer, have a higher incidence of having the BRCA, the breast cancer gene that you hear people talking about, the Angelina Jolie gene. Men who have high-grade prostate cancer have a higher incidence of having that it's a genetic mutation. It's a tumor suppressor gene. So actually, NCCN guidelines, which is National Comprehensive Cancer Network, recommends for men who have high risk or high Gleason's, whatever, prostate cancer, undergo screening for BRCA. That's actually recommended now, because they're showing increased incidence of that, which would mean that if they carry the gene, if they have a sister, whatever, that she very well may have it too, which would mean that she has an increased incidence of also getting breast cancer. So that's another thing that's just kind of come down the pike in the last couple of years.
Wow. Well, listen, our time is up, but it's been a great podcast. We may next month, may need to go back to this topic here.
Sure, we can. I'd be happy to discuss this more. Yes.
Yeah, let's go back into this next month, 4th Monday. Dr. Gooch is on every month, 4th Monday of the month, and we'll come back and go back into this conversation next month. Listen, I really appreciate you, Dr. Gooch. Thank you so much for all that you do for Advancing the Kingdom podcast. I'm very grateful.
My pleasure. Thank you for giving me the opportunity to get the word out and to, as you said, share information and hopefully answer questions and exactly what you're doing, save lives. That's what we're trying to do. That's the most critical and important part.
Yeah, and I certainly want to send a shout out to Mr. Will Battle. I'm not sure whether he's on, but I want to send a shout out to him. He's been a very great friend, and he gave me so much information. I was overwhelmed with all the information that he was sending me, but it all worked out for my good. So is there anything else you want to share tonight, Dr. Gooch? Anything else you want to share tonight?
No, just to let everyone know that initial conversations, ED or men and your men's is just part of your men's health. It's a natural men, the way your body functions is normal. It's natural. It's nothing hidden and secret and private. No one can talk about. This is something, like you said, we need to have these conversations because I don't want men to not get treated because they're worried about potential ED. Let's get the word out. Let's talk about it. Okay. So this is important information for us to talk about and to share and to make sure that everyone's questions are answered. Amen. It's a natural part of life.
Natural part of life, exactly. So listen, if you're over on Facebook, go ahead and share this. I would greatly appreciate it. And if you're on YouTube, go ahead and subscribe to the ML Tillery Outreach or share it over there as well. But if you're on Facebook, I would greatly appreciate it if you could hit the share button. Some great information. A lot of times, men, don't really want to share this because it's just our makeup, right? We just don't want to have these conversations. But I'm grateful for this platform to be able to come on and have these types of conversations. I think they're very important, and I think they're very much needed. So that's why we are doing them. Listen, I greatly appreciate you again, Dr. Gooch. Thank you so much for coming on the podcast tonight. I just really appreciate you just being a great friend.
Thank you. My pleasure. I look forward to doing it again next month.
Amen. So listen, I'm Matt Tillery. Thank you so much for tuning in to the Advancing the Kingdom podcast. Go ahead, once again, hit the share button, hit the like. Make sure you hit the share and like, subscribe, and go ahead and like us over there on YouTube as well. And we will also be on about 10 podcast channels. So you can just type in Advancing the Kingdom podcast or ML Tillery Outreach, and it should pop up on the podcast list as well. I'm once again Matt Tillery. Thank you so much for tuning in to the Advancing the Kingdom podcast tonight. It has been a great podcast, great information, and I'm very excited about what God is doing, and just certainly give him the praise tonight. Listen, until next Monday night at 7 p.m., go and advance the kingdom.
We pray you have been empowered and blessed by this teaching. Join us next week for the Advancing the Kingdom podcast. If you would like to reach us, email us at mltillery@icloud.com.